All right, good afternoon, everybody. Welcome to our afternoon virtual news conference. For those media joining here, as we have done in the past, once we get to the Q&A portion, please use the raise your hand feature. I will call on you, unmute your mic, and you can ask your question. On our panel today, we have Grand Forks Mayor Michael R. Brown, Dr. Josh Deere from Altru Health System, Deborah Swanson, Director of Grand Forks Public Health, and Todd Phelan, the Grand Forks City Administrator. We will be hearing remarks from Mayor Brown, Mrs. Swanson, and Dr. Deere, and then we will go into a Q&A portion of the news conference. So we will start first with Mayor Brown. Go ahead, Mayor.
Well, good afternoon, and thank you for joining us today. There are now 2 reported cases of COVID-19 in Grand Forks County. Based on the magnitude of tests that have been run in the county over the past few weeks, we're not surprised today to have 2 confirmed positive COVID-19 cases in Grand Forks County. It's always been a case of when, not if. This is the time to follow directions and comply with guidelines. Now, more than ever, we need to stress the importance of community health focus. Follow the CDC guidelines and practice physical distancing. And physical distancing means stay at home, wash your hands, do all those things that enhance personal hygiene, and monitor your own health for symptoms such as possible to minimize the transmission and protect the family in our community. And stay home. If you're experiencing symptoms of COVID-19 like cough, fever, or finding it difficult to breathe, call ahead to Altru COVID hotline at 701-780-6358. 701-780-6358. I'm so proud of the work our public health professionals who have been planning and preparing to mitigate the health impact of COVID-19 in our community. We must do our part and help them staying home and stopping the spread. This will be a marathon. President Trump extended physical distancing restrictions to April 30th. Since our region is a little behind the rest of the country, we need to stay the course and prepare for another 6 weeks of this way of life. As Governor Burgum has said, now is the time to be North Dakota smart. Keeping our physical distance is the key to mitigating this virus, and it's important we all continue doing so. However, physical distancing does not mean social isolation. We need to continue to be socially connected, physically healthy, and caring for our mental well-being. Call friends and family, video chat, look out for your neighbors, go for a walk or a run, exercise at home, read a book, play games. We're following the governor and taking a whole of government, whole of community approach. We are in frequent communication with our community partners. This morning, I spoke with UND President Wynn and incoming President Armacost on their efforts and perspectives and how we plan to have a UND representative participate in one of the press conferences in the future. We also have a city council meeting this evening where we will be providing administrative updates on the continuity of operations, flood action planning, and the economic and social sustainability planning. It'll be broadcast on GFTV2 and Facebook Live. We're in this together, and we will get through this together. Be vigilant, be cautious, be North Dakota smart, stay home, slow the spread. Thank you.
Thank you, Mayor. Next, we will head to Mrs. Deb Swanson from Grand Forks Public Health.
Good afternoon. I too would like to extend my appreciation to everyone who's watching this news conference and looking for more information. Now that we have 2 cases in Grand Forks County, it becomes even more important for us to be vigilant to all those public health messages that you've been seeing and hearing about. What happens next, I think, is the question for most people at this point in time. Please know that the Grand Forks Public Health Department has a team of professionals that will be reaching out to contacts of individuals who have tested positive and have reported their county of residence as Grand Forks. They will be talking to those individuals to ascertain what their risk is and to recommend testing and ascertain if they have any symptoms. This is an important, very important part of our next steps in this process to identify people who need treatment, testing, and care. We ask that you continue to be vigilant. We know that people have made tremendous sacrifices the last couple of weeks. Our lives have been pretty much upended the last few days. We knew that this was coming. We've prepared as much as we possibly can. We want people to be prepared, but not to panic. I will be doing a presentation at tonight's City Council meeting that will have quite a bit more information about number of cases across North Dakota, what we're doing as a public health department in terms of all the logistics that are going into this response effort. And I would encourage residents of Grand Forks and the surrounding area to tune into the City Council meeting tonight on our public access channel for more information. We'll be sharing hotline numbers, places where you can get your questions answered, and a whole lot more information. Please know that we are working very closely with our community partners to make sure that all of our residents can be as safe and healthy as possible. And now I'd like to turn it over to our community partner at All True Health System.
Go ahead, Dr. Deer.
Thank you, Debbie. Thank you for the opportunity to be part in this panel. As you have heard, the first 2 confirmed cases in Grand Forks County were reported. In contrast to other large cities in North Dakota, our impact is still low. That said, we should continue to be diligent in practicing social distancing, hand washing, avoid touching our face, and monitoring respiratory illnesses. We continue to prepare as a health system for more cases in our region, ensure we can continue to screen, test, and manage care for these patients. We have plans on both the inpatient and outpatient side already in place. We have a sick clinic that is available and operational 7 days a week. We continue to do screening through the COVID hotline, which Dr. Brown remembered the number of very well. Thank you, Dr. Brown. This has allowed the other clinics in our health system to continue operationally mainly as normal in a safe environment for our general patient population. We have also increased the utilization of video visits and did a lot of preparation last week to operationalize this so we can reach patients in their home and even reaching out further, potentially reaching nursing home patients in their home as well. We continue to test without any changes from the guidelines from our last report on Friday. Currently, we have 469 tests available for community use. We're focusing on proper use of personal protective equipment and realize that this is a vital resource for our staff and patients. Strategies are in place for safe use in the most appropriate care environments, with ongoing work with our partners for ongoing supply replenishment. New technology is also starting up with the fight against COVID. As many of you have seen over the weekend and over the last several days, teams of experts are working at the national level in large corporations, large health systems, and large research centers to help with testing supplies, supplying personal protective equipment, and treatment options for COVID. Again, I'd like to thank you for having me on this forum today on behalf of All True, and look forward to the questions.
Thank you, Dr. Deer. At this point, I will open it up to questions from the media, and that happened pretty quick. Mr. Joe Bowen, please ask your question.
Hi, everybody hear me okay?
Yes.
So we had a whole bunch of questions about the 2 positive cases today. Grand Forks County is pretty big. Can any of you say whether or not either, neither, or both of those people who tested positive live in Grand Forks proper, like the city itself?
I can answer that question. We do not know the exact address or location. I do not know the exact address or location of these residents. We simply get the information reported by county. Once our case investigation starts, that is the more confidential aspect of our follow-up. So at this time, I can't provide an address or a location. We just get it by county, the information by county. We also do not know the source of their testing at this point either. Keep in mind that we have a really good, robust way of testing individuals who need it. And that includes a lot of healthcare providers. All True Health System has done a wonderful job of responding to testing, but there are other providers both in Grand Forks County and in our surrounding region.
Thank you, Deb. Dr. Deer, would you like to add anything to that, or?
Yeah, we know no specifics on the cases, so I would listen to Deb on that topic.
All right, thank you, Doctor. Hand up from KNOX. Go ahead, KNOX.
Sure. Let me see if I can get myself unmuted here. Okay, there we go. This could be for Deb. This could be for Mayor Brown. I'll let either of you take it on. I'm sure people are going to want to know how we make sure that people who test positive stay in the isolation they're supposed to stay in for the period of time they're supposed to stay in it. And that's probably a good question that we should have asked no matter where the cases were. Now that it's closer to home, I'm sure more people are going to want to know. So How does that process take place where we know that the two people who have tested positive sort of isolate and do what they're supposed to do?
I'm looking at Mayor Brown first.
I would pass that to Deb at Public
Okay.
Health. What do we have in place to make sure people follow what they're supposed to do?
Okay, Deb?
I'll be happy to answer that question to the best of my ability. Because we've been through this before with other diseases. We had a TB outbreak in our community a number of years ago, and we did have to work very hard to ensure that people had a safe place to either quarantine because they were exposed to a case, or isolate because they actually had tested positive and may have had the disease. In this case, it becomes even more important that people isolate themselves in a safe place where they aren't exposing others, because of the fact that this is a novel virus and our population doesn't have any immunity to it, and we don't have a vaccine for it. So we'll be sure to be checking in with people to ensure that they're maintaining the recommended level of isolation. If they are ill, they'll be hospitalized, and that will be ensured that they cannot pass the disease on to others who are also in the hospital. We do know that some people have mild illness, and it becomes even more important for those people to maintain that isolation because they still can infect others. We are asking people to be on their honor, but certainly if we find out that there are individuals that are not abiding by that, we do have some tools that are available to us to require containment.
Thank you, Deb. Question from Mr. Joe Bowen. Sorry, Joe, I think we bumped at the same time. Go ahead, Joe.
All right, hi, can you hear me?
Yes, we got you.
Sorry, so it sounds like it's honor system up to a point, and then you said you had some tools to make sure people are doing what they're supposed to do. What are those tools?
Quarantine and isolation is not only for the large public in an incident like this, but it can also be towards an individual. So it can be a local health officer's order or a state health officer's order.
Okay, KNOX, you have a follow-up question?
Actually, a couple of questions for Dr. Deer, not necessarily related to the people that have tested positive, but it may relate to a certain extent. In Dr. Deer, we're hearing a lot about various things that are coming out from the FDA that may take some time to trickle down to the local level, but the FDA has approved chloroquine and hydroxychloroquine for use in certain cases with people who have COVID-19. And we're also hearing from the FDA that they've approved a 15-minute coronavirus test. Can you address either of those products and what you know as far as how they relate to a local level? Are doctors at Altru willing to prescribe those medications now that the FDA has approved them? And do you know when we might be able to get our hands on 15-minute tests?
Dr. Deer.
Yeah, I don't have the specifics on when we'll be able to get the 15-minute test, but I do know that our team is working on vetting those options. It's e-swab and it does take about 15 to 45 minutes to result. So that's something that we're looking into from our testing capabilities. The other question on hydroxychloroquine and chloroquine, majority of health systems do have them in standard protocols for when you can use them. And we're working with all of our partners, including Mayo, to get our inpatient protocols in line with what they're using.
Thank you, Dr. Deer. Looking to the media for any follow-up questions there. Mr. Joe Bowen.
So the two people who have tested positive, were either of those cases travel related, and when were they tested?
I'm not sure where to direct this one. Deb Swanson?
Because the contact investigation is just beginning, they are considered a case under investigation. Once additional information is determined, then they would be either classified as travel or community spread or continue as a case under investigation, a person under investigation.
Thank you, Deb. We do have a quick question. This is a question, I believe, for either Mr. Todd Phelan or Mayor Brown. This is from a Facebook question. House parties. We are a college town. Is there a way to mitigate house parties and gatherings like that?
I would think the gatherings over gatherings over 10 people are prohibited. So we would expect somebody, if they see something like that, to report us so that we can act on it. And I can't believe people haven't gotten the message. Stay at home, wash your hands. If you have to leave your home, when you come back, wash your hands for 20 seconds with hot soapy water, sterilize surfaces frequently, and be aware that this is a real situation and the life you save might be yours.
Thank you, Mayor Brown. Question from KNOX.
For Mayor Brown or Deb Swanson, either would be probably accurate for this one. Over the weekend, Governor Burgum issued some new guidance for people that are travelers, anybody coming home from international travel, along with 24 states that are considered quote unquote hotspots. In other words, widespread community infection. And we don't have any neighboring states that are in that right now, but it's half the country as far as states are concerned where people could be coming back from. We were told the Highway Patrol was going to enforce this 14-day mandatory quarantine if you're coming back from those places. Will our local law enforcement be a part of that in some way, or are we just going to see more Highway Patrol vehicles in town? Because there aren't a lot of patrolmen as it is.
I don't know how the Highway Patrol could manage that function. I don't know if that's in their purview, but I do expect people who are returning to monitor themselves and quarantine themselves for 14 days. And that means stay at home, don't go out, don't expose other people to you until after we know you're safe. So I think we would expect you're on the honor system, but I know someone will report you if you don't.
Okay, anyone else like to take a shot at answering that one? No, Mr. Joe Bowen, you have your hand up.
Yeah, hey, so it sounds like a lot, we basically don't know a whole lot about either of those two positive tests, and it sounds like a lot of that is hinging on like a study, it sounds like, of some kind. When is that study supposed to be done?
Deb Swanson?
Sure, I'll be happy to address how a contact tracing or contact investigation happens. When we get results of a positive test from the state health department, it goes to our local epidemiologist who's employed by the North Dakota Department of Health. And because he won't have the capacity to do all the contact tracing that's going to be necessary, our staff have been trained to do that. So they will be assisting finding out from that individual who they came in contact with the last 14 days. So there again, the mayor's message is extremely important to stay home, because then you won't have to be thinking about who you've come in contact with in the last 14 days. We've all been asked to stay home. The average number of contacts that we're finding in current contact investigation is about 5 people, but the most is about 36. So that's people who are going to work, who maybe could be working from home. It's people who are maybe in small groups, or they have large families. So the more people that you come in contact, the more complicated that contact tracing can be. So once again, it becomes really important to stay home, limit your contact with as few people as possible, limit it to a small number, and that will make the job a lot easier. Sometimes it's very easy to do contact tracing because maybe there's only a couple family members, and then that can be completed in a fairly short period of time, maybe 24 hours. But if there are many more contacts, it will take longer to do that. How you will know it's complete is when a person is classified then as either travel related or community spread. What we do know is we're seeing more community spread, which means people have no idea how they tested positive. They don't know that they were in close contact with someone else who tested positive. What will happen as a result of this process is that more people will get tested, and we will likely see more people who are testing positive.
Thank you, Deb. I see a hand up here from KNOX.
Yeah, so I need to go back to the travel question, and apologies for belaboring the point, but I think we need to know a little bit more about what we're supposed to do. So a couple of these states that are on the list where we're supposed to mandatorily quarantine for 14 days when we come back from them are popular places. Arizona being one of them because snowbirds are there. Colorado, another. People like to go to Denver, et cetera, et cetera. There's 24 states here. So the governor's office said the Highway Patrol would enforce it. If I'm one of these people coming home and the Highway Patrol can't enforce it, Deb, Mayor Brown, what am I supposed to do? Do I call somebody to tell them I just came home from Arizona? Is that completely on the honor system as well, that I just know I came back, so I stay home for a couple of weeks? What's the process for somebody coming back from one of these states?
Deb Swanson.
It is the honor system, and that's why we're asking the public for their help. The public has a lot of control over how the virus affects people in our community. However, I will say this, the order from the state health officer, also it is a state health officer order, just to clear that up, it's not a governor's order. And what it does is it ensures that the public is in as safe a place as possible to prevent the spread. There is a provision in there that if people feel they do need to leave their home, they can contact the local health department and we can give them advice. For example, if they need to go to a doctor's appointment, we'll advise them to call first so that they know where to present. If they need help getting food or some other basic service, we can assist them to make sure that they know what those resources are in our community. As far as enforcement, if it's reported that people are not maintaining that quarantine, yes, there are some provisions for law enforcement. I think Mayor Brown's right. It's probably not realistic to expect that the Highway Patrol, but that is a law enforcement agency that is under the purview of the governor. So I'm sure that's why he mentioned the law, that particular branch of law enforcement.
Thank you, Deb. I do have a question. This is for Mr. Phelan. Came over Facebook. At what threshold within the city do we expect to see changes to the city bus system? So I'm looking at Mr. Phelan on this one. Go ahead, Todd.
Well, public transportation, even from Governor Burgum, has been noted as a essential service. And for essential things that people have to do that do not have another mode of transportation, whether that's to a medical appointment, to a pharmacy, to a specific store, so that they can function on a day-to-day basis. So we anticipate, much like law enforcement, public health, waterworks, that public transportation will continue as an essential service. And I think that's been the message of Governor Burgum throughout the state and throughout local communities like Grand Forks that have public transportation systems.
Thank you, Todd. Looking to the media, Mr. Joe Bowen.
Yeah, hey there. Will Altru still be sending people's past due medical bills to collections during the pandemic?
Taking a look to Dr. Deere.
I can't speak to the specifics of our finance department, but if you want that question answered, I can get you in contact with someone that can.
All right, with that, we'll break away from our.
And KNOX is hit a break. Looking at our media members, any other hands to go up for questions? Mr. Joe Bowen.
Yeah, does Altru have enough supplies to protect all its doctors and nurses? And what are you guys doing differently than Sanford, where a handful of staff have already tested positive?
Yeah, I can't speak to the specifics on what Sanford or Trinity or any other health system is doing with regards to their supplies, but what I can say is that we're actively managing our supplies. We feel comfortable with our amount of test kits, N95 masks, surgical masks, and actually we received our 40% allocation from the state, North Dakota Department of Health today. That included 33 pallets of supplies. So that's a lot of supplies. The picture was pretty impressive. So I'd like to thank them for following through and bringing us the supplies that we need. And we'll continue to change, as every other health system is, with who's using masks, when they're using masks, and how we can make sure that we safely treat our community, patients, and staff.
Thank you, Dr. Deere. Another question from online. This is for Mayor Brown. At what threshold do you feel that there may be potential for a city order to close non-essential businesses? Right now, it has all come from the state. Do you see anything down the road that may trigger a city order?
No, I would expect guidance from the governor and the CDC about when we would have to take that next step.
Okay. Thank you, Mayor.
We still encourage people to stay home. If you have to leave home, when you get home, wash your hands for 20 seconds, avoid crowds, cover your cough, and be vigilant, because this is a serious situation.
Thank you, Mayor. looking to our media list here. And any other questions, Mr. Joe Bowen?
Yeah, is there any specific sort of guidance, directives, whatever, from the Department of Health for grocery stores or gas stations to reduce the spread of the virus?
Looking at our panel here, Deb Swanson.
Yes, there is guidance available on the North Dakota Department of Health website. It's general guidance and it links back to the CDC. But what we have been seeing is that, especially among our major retailers, they're also receiving information from their national suppliers and their national organizations about best practices to employ during this time as well. We don't have any specific concerns at this point, but we do want to make sure that all of those important places that are providing essential services to us also are safe places that people can shop and get the essentials that they need.
Thank you. Mr. Bowen, your hand is still in the air.
Oh yeah, my bad. Has the unemployment portal been updated to allow claims for self-employed and contract employed people?
Boy, as I look at this group here, it's more of a state question. Mr. Phelan.
John and Joe, I know that was a discussion point over the weekend with Governor Burgum, and I think there were going to be some updates leading to today, so that there was more guidance and clarifications, and administratively how people can move forward with unemployment benefits. So I think if it already hasn't happened, it was in the move to do early this week.
Thank you, Todd. Looking at our media panel here, Mr. Bowen.
Yeah, is there any sort of guidance for people who sell online their some like personal items, I guess over like eBay and that sort of thing? Should they stop doing that?
Again, looking at our panel, Mrs. Swanson.
I don't have any knowledge of specific guidance for those circumstances, but I do know that the North Dakota Department of Health webpage that's specific to coronavirus has a wonderful frequently asked questions section. And I would encourage people to take a look at that, no matter what their question is related to unemployment benefits, anything about the virus, anything about health that we're requesting people do. There's just a tremendous amount of information there. It's possible that there's information about mail and delivery commerce, but I'm not really sure about that. But it's a great resource, and I would encourage everyone to take a look at it.
Thank you, Deb. Joe, your mic is still open if you.
Yeah.
Go
Let's
ahead.
see here. It's my understanding that some of that stimulus package money is going to get sent to states like individually. What is the plan for stimulus package money that's going to North Dakota? Does anybody know that yet?
Mr. Phelan, go ahead.
I think part of that is to be determined, and we certainly know, and we've been instructed and generally heard that there are going to be some small business administration loans, and there's been some real guidance on some of those may be forgivable under certain circumstances. Unemployment benefits, we have been told, are going to be positive and robust even in these challenging times, and I suspect we are going to receive funding via the states for COVID-related expenses also. And so those are the three categories of number one, trying to get small business back up and going, helping people that are unemployed currently during this short period of time, and then finally reimbursing of some of the expenses related to the COVID disaster that the federal government is dealing with, and obviously that's spilling down to the states and the localities. And I suspect there'll be other programs that are going to come through all the multiple federal departments that are going to cascade to the states and then to local governments. And so Meredith Richards from the city of Grand Forks, from a kind of a business community development perspective, is going to be tracking that, and we're going to be hopefully nuancing our own programs to our own local needs here in our own community. But more to come over the next week or so, as more is to come, and when the money starts to filter down at the states and to the localities.
Thank you, Mr. Phelan. Looking at the media here, I can just go down the line. Go ahead, Joe.
Has Grand Forks Job Service waived its waiting period for unemployment benefits?
Boy, I'm Not sure if this is the panel to answer that one, Joe. I understand the question. I just, I don't think anyone on this group has firsthand knowledge of that.
No worries.
Fair enough. Go ahead, Joe.
All right. So if people come back to the state and they're supposed to be self-quarantining and they're not, is there a way for others to report that? And if so, what is it?
I'm going to defer to Deb Swanson on this, just on the process a little bit, specifically if it gets to mandatory quarantine.
Yeah, local law enforcement would be able to respond to that. And certainly people who have concerns about like a business or an entity that's not following through, they could contact the local health department. We do have a number that's answered, 787-8100, and we would certainly do our best to engage law enforcement to the extent that it's appropriate.
Thank you, Deb. And I'm sorry, Todd, you had your hand in the air.
And John, just a follow, I think, we have a really a progressive and proactive Grand Forks Police Department. And I think some of these matters, and we probably didn't ponder it at the time, are going to be about community policing, of providing guidance, providing follow-up, and providing proactive measures. So probably things that we didn't anticipate before this pandemic are going to be part of local policing, will be integrated into local policing throughout all the different neighborhoods that our police department is covering in their different sectors.
Thank you, Todd. Taking a look, Joe, I see you open your mic.
Yeah. Sorry. So I know we touched on this a little bit, but I want to just make sure I kick off a lot of these. When or how will social distancing be enforced by police or something along those lines? Sheriff's Department, Highway Patrol.
Mr.
Sorry,
Phelan,
someone is very cool.
Yeah, go ahead, Mr. Phelan. Go ahead.
Again, when just as a follow-up to Joe's question too, is, the local policing element is that our chief of police in our daily briefings, our police officers are out in the various sectors throughout the community of Grand Forks. So we're going to be demonstrating a presence. And as we need to be proactive to demonstrate that we do have a presence in the various neighborhoods and sectors of the community, and that we can react when there are larger groups that are commingling beyond what is recommended. So we're going to be more proactive. We're going to be present, and we will probably have to break up, whether it's a loud party at night on weekends as we come to the spring, or if it's in a park or other public gathering places where we have to break people up. That will become part of community policing to protect our community.
Thank you, Todd. Go ahead, Joe.
Well, any of these social distancing directives, kind of regardless of whether or not there's an enforcement mechanism, will they ever be maybe tightened to say include people's shopping? Like, is there ever going to be a directive to say only go out if you're going shopping for the essentials? Something like that?
Taking a look at the panel, I think Deb Swanson and then maybe Mayor Brown to answer this one. Go ahead, Deb.
Well, I do believe it's already been alluded to that we would take some direction from what's happening at the state level, because while we're geographically a large state, we're very connected, and we know that we have a lot of social connections across the state. So I think, well, we don't have numbers specifically, but when we start to see a lot of community spread versus travel, that's probably an indication where we might need to take further steps to protect the population.
And this is the time to be North Dakota smart. Stay home. It can wait.
Okay, Todd, I saw you raise your hand briefly for that one. Would you? No, you're good. Okay. Taking a look at our media members. Go ahead, Joe.
All right, I got two left here. Apparently, there's a rumor going around that the $1,200 most people are set to get from the feds, that's just an advance on next year's tax return. Does anybody know if that's the case?
Looking at the panel, Mr. Phelan.
To that question, John, I've never heard it described that way. I've heard it described as part of the stimulus bill, so that it would be new money based upon 2018 taxes, which would be the last fully committed tax through the IRS. So I've never heard it described that way when it's been described to me.
All right, thank you, and I'm sorry we don't have an accountant on here to answer that one. Joe, you said you had one more.
Actually, I think I'm at the end of my list, I apologize in advance to anyone listening if I missed theirs, but I think I got them all. I
Perfect.
miscounted.
So thank you. Along those lines, thank you to the panel. We will do this again on next Wednesday. We'll do this on Wednesday at 2:15 again, and on Friday at 2:15. And again, thank you to Dr. Deere, Mayor Brown, Mrs. Deb Swanson, Mr. Todd Phelan. Thank you for joining us. Thank you to members of the media helping get the word out on this. And we will see you again on Wednesday. Thank you very much.